do. But the main thing was this, that can we do this? And this is exactly based on same thing. You stimulate a motor nerve. Let's say you stimulate a median nerve at carpal tunnel, just before carpal tunnel, and you see the median nerve muscles, let's say abductor pollicis brevis, and you will see some action potential of it. And there are two parameters you can measure. You can measure from the time of stimulation when the current started, when the voltage started or the potential started, and this is called latency. So latency can depend on where you're stimulating. If you're stimulating at the wrist, latency will be small. If you're stimulating at the elbow, latency will be bigger. If there's a compression or injury, then latency will increase. So if you know the latency before operation, you know the latency from the point A to B. And then during the operation, if this latency increases, then you know there's an injury in the spinal cord. So one, we measure the latency, and the second we measure is the potential, which is the height of the graph. So this height, whatever the potential it is, if you know beforehand it was, let's say this was 10 millivolt, and then suddenly it become 2 millivolt or 1 millivolt from 10, that means there's a significant change, and that is what we measure. So we measure the potential in the voltage, and we measure latency both for sensory and motor, just like you measure your nerve conduction study. And this is again showing that in a nerve conduction study, you can stimulate a motor nerve to get the motor potential, which is called compound motor action potential, or you can stimulate a sensory nerve and you can get a sensory nerve action potential, which is called a SNAP. But in your neurophysiological study, the same thing. This is called a motor evoked potential, and this is called a sensory evoked potential. And since we are not doing, we are doing the cutaneous sensation, it is called somatosensory evoked potential. So just remember these two words. If you're doing visual, for eye, you want to check, then called visual action evoked potential. If you want to do hearing, you will call it auditory evoked potential. But since we do normally do a skin, so we call that somatosensory evoked potential. Although you can do for vision, you can do for hearing, you can do for other things for cranial nerves, but we mainly do it for skin. So we're doing somatosensory evoked potential and motor evoked potential. Just remember these two things.